The following segment is presented by Bremo Pharmacy.
So many of us are on so many medications. You have prescription drugs, over-the-counter drugs, and even herbal supplements. It's important to know how those drugs interact with each other and whether or not you're overlapping any medication. Bremo Pharmacy offers a fantastic service. It's called Medication Checkup. And our friend Ann Anderson is here to explain exactly what a medication checkup is.
A medication checkup is the opportunity to come in and sit down with a clinical pharmacist with a scheduled appointment, one-on-one, and review all the medications that you're taking, the things that you just mentioned, your prescription medication, over-the-counter medications like Tylenol, cough and cold preparations, vitamins, herbal supplements, anything that you're taking comes with you.
And that's why it's so important to have somebody who's trained to know how these things interact with each other. I know I got into some trouble personally with some herbal supplements really affecting some of the prescription medication that I was taking. So having a pharmacist look at that. What are some other reasons why it's so important to have this done?
Well, it's important to have it done, especially if you're taking several medications or seeing many different physicians, or you've just gotten out of the hospital. You need to make sure that you know what you're taking, why you're taking it, how to take it, to best benefit you and the chronic disease that you're trying to manage.
Yeah, doctors don't always talk to each other.
Absolutely not, and people don't always know what they're taking.
And oftentimes there are two drugs that do the same thing, they're different names. It can be very confusing, very overwhelming. Is there a particular client that you come into Bremo to have these medication checkups done?
Well, we think mostly about seniors, but anyone who's taken several medications or seeing different physicians, or if they've just gotten out of the hospital and their medications have changed, that's a great time to come in because the drugs they got in the hospital may not be the same ones that they were on when they were in the hospital. So you don't want to have overlapping medications when you get out.
And we've talked about the importance of recognizing that your body changes over time as well and how that can affect medication.
Right, and many people think, oh, I've been on the same medication, same dosage all these years, I don't need to have this done, but you do. Your drugs may not have changed, but the way your body metabolizes and eliminates that drug has changed. And you do need to get it checked out to make sure you're not building up toxic levels of the drugs.
Absolutely. I think it's also a great time to point out the importance of having all of your prescriptions at one pharmacy for those reasons.
It is, absolutely, because your pharmacist has been to school for many years to become the experts in medication, and it pays to have that wonderful resource at your disposal who can look at all of your medications that you're taking from all the different physicians that you're seeing so they can see the whole big picture and make sure that what you're doing is right for you.
One set of eyes on
Absolutely.
one patient. It really works out great. And Bremo Pharmacy offers a lot of other things for medication care like SyncRx, where you get your prescriptions filled all at once, and also compliance packaging.
We do.
The compliance packaging helps people keep up on their medications.
Absolutely. So if during that MTM you find out, or medication checkup, you find out you can't keep it organized, we can help.
All right. Well, you'll want to call 288-8361 for more details.